I'm Dr. Jess, and I'm back with another episode of No Pain is Gain. In today's episode, we're talking about balance and fall prevention.
The old adage is wrong. Pain is not a reward for hard work, nor is it an unavoidable consequence of aging. No pain is gain.
Falling is prevalent in our community, and it is a huge concern for many individuals and many seniors. So the question is, why are people falling? And if we can understand why people are falling, then we can help fix that. So there are 4 reasons people fall, and one of them is probably the most noticeable one, or the most often suggested, which is balance, right? We'll hear that my balance is bad. And we're gonna dive into what balance is here soon, but that is definitely a reason people fall. Balance is bad. The second reason people fall is because of the environmental factors. So what that is, right, is maybe it's clutter in the home, maybe it's a throw rug that can easily be removed. Maybe it's poor lighting in the home, right? The environmental factors are going to impact whether someone is going to fall or not. And if you know that it's the throw rug that's causing the falls, we can fix it. A third reason is medications. It has been shown that someone who is on 5 or more medications can be at increased risk for falling. Now, does that mean you do not take your medications? Absolutely not. You listen to what your doctor tells you and what you need to take. But it is something to reflect on and determine, I'm taking 6 or 10 or maybe even more medications, and maybe that's the reason why I am falling. And it is a great conversation to start to have with your doctor. The last one is fear of falling. So many people actually fall just because of the fear of falling. When we move, we are designed to move in an efficient manner. And if we're fearful, we actually hesitate, or we become guarded and we change the way that we move, which actually increases your risk for falling. So if you're nervous to step down off of a curb, you're gonna slow down, you're gonna maybe go slower. Well, this skill to be on one leg and slowly lower yourself is actually significantly harder than someone who isn't fearful and uses the momentum to step down. So again, fear of falling is a huge one that actually ends up being the reason people fall. And I do not anticipate or ask anyone to just go out there and not be fearful. Obviously, there's a reason why you're fearful. So the way that we would fix this one, right, would be working with whatever that fear is, or coaching you through, or maybe it's the weakness or the balance that you need to improve this portion of your fear of falling. So, those are the reasons why people fall. And if we know the reason, we can fix it. Okay, so we now know the common reasons people fall, and one of them is balance. But I will always challenge you to ask yourself what parts of balance are being impacted that are causing your falls. Because balance is dynamic. There are multiple things that make up balance. There are your sensory systems that include your visual perspective, your proprioception, there's the vestibular component. I'm sure many of you heard of vertigo. All of those impact balance. And I'm going to show you today how we test those and how do we know those are involved. There's the musculoskeletal portion of it, and I break those down into posture, basis support, strength, flexibility, endurance, coordination. All of those impact balance. So again, if the balance is the reason people are falling, we have to understand what parts of balance they are to help the individual or help you as an individual. And that's really what's going to drive the success of overcoming any sort of fall if it's for balance. So this is the timed up and go. It is a test to determine if you are at risk for falling. I have the patient go ahead and stand. When I say go, they'll walk to a line, they'll turn around, and they'll sit back down. Based on that time, it will determine if you're at risk for falling. Anything above 12 seconds, a patient or a person is at risk for falling. Anything less than, you are not at risk. Ready? Go. Good, and he did that in 8 seconds, so he is not at risk for falling. Okay, so this is another test that we can use to determine if you're at risk for falling. It's called the 5 times sit to stand, and what you'll do is you will stand 5 times and sit 5 times, and I'll time it. And based on your age and the time that you receive will determine if you're at risk for falling. So I'm gonna have Dr. Christopher, when I say go, cross your arms and go from sit to stand 5 times when I say go. Go. 1, 2, 3, 4, 5. Great. And then I would use this time of 8 seconds to compare with his age if it was in the range of being at risk for falling or not. Okay, so we just got done talking about balance, and balance is very dynamic. So the next time someone tells you that your balance is bad, or you say your balance is bad, my question is, what parts of balance? And right now, I'd love to demonstrate how we test the sensory systems to determine if that's the part of balance that's really impaired. So if vision is one sensory system that impacts the balance, how do I test that? Well, I have my patient or my friend or my colleague come over here, and I would have him close his eyes. And I would watch for wavering. And if someone has balance deficits due to the visual component, you will see them sway. Go ahead and sway for me a lot. You will see a lot of swaying happening, right? To the point where they actually might need to hold on to something. Go ahead and open your eyes. Another reason why people might have a visual challenge when it comes to balance, right, is cataracts, visual changes as we get older. But also, sometimes I hear, it's hard for me to walk at night. I'm fine, but then I tend to lose my balance at night. Well, yes, because the dark is altering that perception of vision, which is impacting the balance. So how do we help? We install a nightlight maybe where you're walking at night, right? But we got to understand the why and what parts of balance to intervene. But that's just one sensory system that we're able to check here in our clinic to determine if it's your eyes. So we were just talking about how balance is dynamic and that the sensory systems impact our balance. Eyes, ears, and feet. And I'm going to go into the concept of feet, or something that I talk about is what's called proprioception. So proprioception is we have receptors in every part of our joints that communicate with our brain. So if my arm is out to the side, I don't need to look at my arm to know that it's out there. I have receptors in each joint communicating to my brain that my arm is out here in space. If I am walking, I should not have to look down at my feet. I should know that my foot is out in front of me and where it is in space by the receptors that are in each joint communicating to my brain. However, if there is a disconnect with that communication, whether it's an injury or a joint replacement, or maybe as we're aging, those receptors decrease, right? We no longer have that capability of understanding where our arms or legs are in space. So I hear people say, I feel like I have to look at the ground everywhere I walk, right? To me, that would tell me that part of their balance is what's being impacted. So how do we test this, and how do we actually help someone regain proprioception or improve the receptor communication to the brain back down to the joint? And it's this fun piece of foam. This isn't the only thing we use, but it is one great tool that we do utilize here in the clinic. So what I would do for a test to first determine if it is the receptors that is causing the balance issue is have the patient step onto the foam. And again, I would watch to see if they would waver back and forth. If this was a problem, you would see a lot of swaying or potentially loss of balance where they'd have to hold on to remain upright. So this would confirm that there is a challenge or a deficit at the level of the receptors communicating for proprioception. And how we work on it, we practice standing on this foam. Okay, so basis support, that is one component that can impact balance, but what is it? Basis support is our support system. So if our feet are wide, it's a good support system. If we're feet together, narrow, standing on one leg, even more narrow. But why would we need to stand on one leg? Well, because we are designed to function in a narrow base of support. Every time we walk, we're on one leg. Every time we take a step up, we are on one leg. And if we have to step down from a curb, we're on one leg. So we need to be able to function standing on one leg for the success of balance and to prevent falls. So narrow base of support. How do I know, right, if you have trouble with single leg stands? Well, it's quite simple. I would have my patient or my friend or my colleague, right, stand on one leg and see if they can stand. They would need to be able to stand for 10 seconds or you would be at risk for falling. So if a person could stand for 10 seconds, I would know that that is not the problem with balance. However, if they can't, we might start to discuss assistive devices to help widen their base of support when they're standing on one leg. So best practice for a cane for fitting is you actually want the cane, when you hold it by your side, your wrist to fall at the level of the handle. From there, you'll know that it's the perfect elbow bent around 20 to 30 degrees, and you would always want to hold it in the opposite side of weakness or pain. So if it is my right leg that is weak and I'm unable to stand on my right leg by itself, I would hold it in my left hand and I would work simultaneously advancing the cane and the leg together. So it would widen my base of support. So another thing that can impact your balance is posture. And one analogy I love using is having my friends, my colleagues, my clients, my patients, right, to go ahead and make a fist, right? If they make a fist and they wanted to hit something, they could do so. Now I have my colleague or client or patient, right, open their hand, bend their wrist as if they were being flexed forward with poor posture, right, bent forward with poor posture. And now I tell them to make a fist a lot harder. And I ask them, would they prefer to hit something or, utilize a fist in this way or this way? And everyone says this. So the question becomes, why? It's the same joints, it's the same muscles, it's the same bones. Well, we are not designed to move in this way. We are not designed to function this way. We're not going to be able to take long strides. We're not going to be able to clear the floor when we're bent forward. So posture is everything when it comes to balance and falling. The big takeaway here is that balance is dynamic, and I only have dived into a certain few things that impact balance, but we have to remember there are multiple things that impact your balance. And if you ever feel that your balance is causing your falls, we have to figure out what parts of balance. So please keep that in mind when you are trying to figure out what's best for you. So please remember that there are many components that impact your balance, and It's not that you're just getting old. I always question and wonder, how can an 85-year-old have no problems with balance, not be falling, and have no pain? And I see some 65-year-olds with localized pain in their shoulder, they're falling, right? We can't always just sum it up as you're getting older, because it really doesn't mean that. Everyone's gonna age, everyone's gonna go through different changes in life, but if you understand the why and you work on the why, you can fix it and prevent all of it, regardless of age.